January 5th, 2022 meeting of the Oyster River Cooperative School Board coming to order. Our first item of business is the approval of the agenda. We have a motion to approve the agenda. Tom?
So moved.
A second? Second from Brian. Any additions, changes? All those in favor of the agenda as presented? 7 in favor, student rep in favor. The agenda is approved. All right, that brings us to public comment. So, Mr. Fenton, you've got your 3 minutes, please.
See, this is a perfect example. You don't understand the nature of force and violence. That's one of the most important things that you can be doing as educators or somebody responsible for education. You don't see the force and violence in the room. Just now, witness, just now, this guy, and you just shook hands. You just broke a rule that if somebody else breaks a rule, you can selectively choose to exercise force and violence. You don't see the gun in the room. You don't see that this is force and violence. You don't seem to think it. The Principal Goldsmith from the school, when he just randomly decided to have a mask mandate on Halloween, when a town that didn't have a mask mandate, he didn't see the force and violence. He didn't see that as a violent act. You don't see this as a violent act. You think you're some kind of moral, peaceful people because you're enforcing this thing. And I've asked many, many times, and I've confirmed with you, that you'd have armed men remove me. Now, what you should be teaching the children, the nature of force and violence, there are times when it's okay to use force and violence, and there's times when it's not. The time that it's okay to use force and violence is if somebody else does violence to you first, in defense of your life or your liberty or your property, or in the exercise of justice. So your only moral argument that you can use force against me is if I'm doing violence to you. Oh, he's the bad guy, he's breathing the bad air. That's an act of violence. Therefore, we are moral in using our violence against him. No, you're not. It's not I am not acting of act of violence by taking my mask off. I asked you what happens if I have a negative COVID test 2 weeks ago. And we have this guy going out to football games without a mask. We have Dr. Morse's employees without masks. We have Tom without masks. We have other members of the board. I was quite enthused and encouraged that after my last speech, I had 3 parents call out talking about some of you, and I would encourage any other parents watching this to call me as well. So it's not about violence. You're not justifying this saying, oh yes, we're very afraid. This is an act of violence and therefore we can do violence against you. It's not. It's not moral. You lose all moral ground when you're not following it yourself. When you're not, you can't make a claim that I'm doing violence to you by taking this off. I'm not.
Mr. Fenton.
I'm doing violence by you. All right, what I would like to do in closing, I want to invite you and Principal Goldsmith, if he's here, any other board member. I am unarmed, I am peaceful. I would like to invite you to come up and beat me. Beat me, hit me, hurt me. If you feel that it is warranted of violence and you can do it, come do it. But don't you dare take my tax dollars and tell men with guns to come into a school and do violence to me. And don't say you have the moral high ground to do that, because you do not. Do it yourself. Beat me, hit me, hurt me, kick me on the ground, tase me. I'm sure you'd get great glee of it. I'm sure you all are all hoping that that's what the police would do. You're violent, you're authoritarian, you have absolutely no moral justification whatsoever. Zero. You have no moral justification.
Mr. Fenton, your 3 minutes are up.
And I'm going to mind my own business. I ask you to please ignore me.
Your time is up, Mr. Fenton.
Please ignore me when I sit down. Please ignore me. Don't interrupt your meeting. Please ignore me. That's all. Don't bring men with guns in here. Let me just go about my business. You go about yours.
All right. We're going to take a 5-minute recess. All right, we are back. Our next item of business is approval of the minutes. We have both the November 18th budget workshop and the December 15th regular meeting minutes. Brian,
Motion to approve?
are you moving to approve both?
Approve both, yes.
All right, we have a motion from Brian, a second from Denise. Any additions or corrections for either the workshop minutes or the regular meeting minutes? None?
No, sorry.
Easy does.
Go ahead, UC.
On the November 18th minutes, page 3, UC Terrell asked what the impact on taxes would be for the 3 towns on a 300,000, not 400,000.
Can you pull?
Excuse me. Let's start again. On page 3, UC Terrell asked what the impact of taxes would be for the 3 towns on a 300,000 and 600,000 a house. And also in that one, Brian, I had a question for you because it would be changing one of your notes. Brian Cisneros was concerned that we are not holding the line and that raising taxes will violate the trust that we have developed since the approval of the new middle school. I wondered, Brian, if you would be open to we are not holding the line and that raising taxes beyond the 4.1% upper boundary of the board goal would violate the trust that we have developed. Do you know where I'm referring to?
Yeah, I'm fine with the way it is.
Okay.
Others?
One more on,
Can you provide that to Karen?
yep. One more on December 15th on page 5. The date of the second community event is January 26th, not January 23rd.
Right.
Did you find it, Karen?
It's on page 5 in section 9. End of section 9.
Anytime you need more time, just raise your hand or ask to have it be repeated, just so you get.
All right, any others? With those corrections, all in favor of the minutes from November 18th and December 15th? 7 in favor and the student rep in favor. The minutes are approved. Announcements, commendations, and comments from the district.
Good evening, David Goldsmith, principal of Mohermet. Wanted to just give you a little summary about our return to school from break. It's gone really well. Everyone's happy to be back and to be back in person. I say it's gone really well. We did have a real challenge in the past few days based on the COVID situation, and so I wanted to just illuminate that a little bit for you. And first, I just need to commend the entire staff of our building for following guidelines and making it very easy for us to figure out quarantining issues, and the majority of our students are not impacted because we're following our guidelines, and it makes it really helpful. And to all the families who are, of course, having their children follow those guidelines as well. We had 27 students absent on our first day on Monday. By the time we got to today, we had 15 absent. 19 on Monday were due to COVID situations, and by today it was down to 9. And so that is improving. We've had 4 or 5 staff members out because of COVID, and we cover those absences. We have had an issue with substitute teachers all year long, as has every school. We have our resident sub in the building who is able to do that, and then usually we have about 1 sub available per day in the building as well. And I just want to point out that while the staff does an amazing job of covering absences, and all of our students are always, of course, supervised and being taught, when we move people around, it impacts different programs. If a tutor is pulled to cover an entire classroom, then Tier 2 services don't happen. We've been talking about Tier 2 a lot, and that's just one example of things that change. So while we're able to cover everything, there is an impact, of course, to all of that. And then, just like we as a school do when we call families and have them come pick their children up, our staff, many of them also have children in school and get called in the middle of the day to come pick their children up. And so that happens to us as well. And then all of a sudden, in the middle of all of this, we have to have new coverage juggling. So again, I can't commend the staff enough for the way they juggle and support each other and collaborate to really cover and go beyond covering and do the very best they can to provide whatever educational experience was supposed to be happening. But it's definitely impacting our school. The atmosphere is really positive and wonderful about it. We're super glad to be back. That's where we are.
Okay.
Questions?
Thank you.
You're very welcome.
Good evening, Misty Lowe for Mastway School. I echo a lot of what David said. Mastway, not to over-dramatize it, but has really, really been struggling. We have 7 to 10 staff members who are out daily. We have 1 to 2 subs available at best. So we are having to pull from a variety of staff in order to make the day work. My parents live with me, and my dad looked at me Sunday night and he could see my worry about how to run school. And he said, "Is there anything I can do?" And I said, "Well, you can volunteer. You're healthy, you're vaccinated." And he did. So my dad spent a lot of time with me and the kids in the cafeteria, on the playground, at school, in order for us to function on Monday. So I'm just putting it out there that there's nothing that makes people have more joy than a grandparent in an elementary school. It's much like having a child in a retirement home setting. So if there are any healthy, vaccinated retirees that want to volunteer, reach out to Mastway. Our numbers are similar to David's, a little bit higher. Excuse me. Since we've returned, our student absenteeism has varied between 40 on an average day, sometimes 35, 39. The majority are COVID related, a few are not, but it is impacting our building a great deal. Off of COVID, on a happy note, I wanted to publicly thank the Alumni Association. They have been donating books to teachers at Mastway School to help diversify our classroom libraries, and I want to do a shout out to Anita, as well as the Alumni Association, as a thank you.
I had a question about the role that people in the community can play. Even thinking, if I could come in and be in the classroom while a teacher is teaching remotely, but just to allow the students to be in school, that would be something that I think many community members would step up in. Is you mentioned volunteer, or is the word sub? Do they need to go through, what process would someone who might have some flexibility, didn't want to do this on the long term, but certainly didn't want schools to close, how could they help?
So we all need substitutes desperately. That would be contacting the SAU to apply to be a substitute and go through the vetting process at the SAU with fingerprinting and things of that nature if you're going to substitute in a classroom setting. Volunteers, we make sure are with a staff member, if you will. So when my dad was volunteering, I was with him, but we are so short-staffed that it took him and I and others to cover recess duty, cafeteria duty, just lunch monitors, bus duty. He was also our crossing guard that morning, which was great. Traffic is challenging, as you know, because we have so many parent pickups and less kids on buses. So I guess I would say if you are able to sub, you do not have to sub full-time. You can still have that flexibility. We have subs for half a days, full days. Thanks to all of you, we're even able to do hourly substitutes at this point in time. So if people just have a couple of hours, volunteering is great and subbing is great. That would be how I
So,
would respond.
UC, in terms of, we have volunteers all through the district, particularly in our athletic program, and they go through the same vetting process in terms of fingerprinting. The district pays for the fingerprinting, so if people want to volunteer, they don't want to substitute, they want to cover, like you suggested, a classroom while a teacher's teaching remote, that's terrific. Just contact the central office, and we'll go through the vetting process, fingerprint them, and as soon as those fingerprints come back, we're good to go. And the latest process is we can use electronic fingerprinting if the person is willing to go to Dover. So I think we have to set up an account for that to happen. We were just talking before the meeting. Right now, we do it the old-fashioned way. They get their hands dirty, we send it off to the state police, and they vet it through the FBI, and we get it back. It usually takes about 2 weeks. But Denise was sharing that in her organization, they're starting to use the electronic process, and that's almost immediate. So thank you, Dad. Give him big hugs for us.
Thank you.
Thank you.
Good evening, Jay Richard, the principal of the middle school. I'm going to do 2 brief reports tonight, one for Principal Noah, who's unable to attend tonight. Great start back at the middle school. We definitely had some groggy bobcats coming into the building in the morning, kind of getting over that sleeping in type situation, and no doubt Principal Noah had the same situation, but kids are very enthused to be back at the middle school and the high school. Huge credit to our nurses, of course, at the high school, middle school, and of course the elementary levels. The amount of work that they need roller skates, they really do. They're that busy, same as the sub-coordinators. One of the things, we had a leadership meeting, I think it was Monday morning, with Dr. Morris and the other leaders, and I actually felt very fortunate. I only had 1 staff member out, so it's pretty easy to cover with our sub-coordinator. But I just want to remind everybody, it's a fluid situation. It changes on a moment's notice, and just later that afternoon, I had a couple staff members that we had to cover for. What we're seeing is, again, particularly at the high school, we did have our COVID number spike in terms of the student population. We're a little bit more fortunate at the middle school. So things are good. Days, let's talk about days, calendar days, right? That's 53 days till we move into the new middle school, 28 school days. My assistant principal, Bill Sullivan, and I, we count them differently. We had a construction meeting on Tuesday. My adrenaline started to flow, and this is so exciting for our entire community and kids to get into that building, the finished work starting to come together. So I just, again, I know I'm being repetitive, but I'm so grateful to the whole community that our students and staff are going to have the opportunity to move into that new facility on the 28th. And lastly, Principal Noe, she's going to move the Winter Carnival, Winterfest. The plan right now is just the potential of snow, and with rising COVID numbers, she wants to make sure our students have the best possible experience. So her tentative date right now to move the Winterfest is February 18th. Thank you.
Thank you, Jay.
I'm sorry, Jay, did you say did I miss how many students were absent?
We had on Monday, we actually had 58 students absent.
Okay.
So I apologize, I did not get the precise numbers from Principal Noe.
Okay.
But that's about routine, some people are coming back late from vacations and things like that. But again, we felt fortunate at the middle school to not to have the impact, particularly, for example, like Misty did.
So is it 58, is it steady, 58 the last 3 days, or?
Yep,
Okay.
about that, yep.
Okay, thanks.
Thank you.
Thank you. Anybody else? All right, and from the board? Denise?
I wanted to thank Mrs. Anderson for inviting me to participate in the discussion. It was the Rethinking Education panel discussion. There were 2 sessions. I was only able to attend that one, but very much enjoyed speaking with the students. I really want to thank them for sharing their views in terms of what is working in our educational system, what types of changes they think are important. It was a very interesting discussion, and the class time absolutely flew by.
Thank you. Lucy, was it?
I wanted to commend the teachers and administration for shifting so quickly to the remote day. There were certainly hiccups at our house in students remembering how to do that, but all in all, I think it went very smoothly, and was glad that some of the fun end of year activities that were scheduled for that day are being rescheduled in January and February so that the students don't miss out on that fun.
Today, the State Department of Health and Human Services reported the highest number of active COVID cases of the pandemic thus far. We know that there is no silver bullet, there is no precaution, there is no drug, there is no vaccine that completely 100% protects an individual or the community from transmission of COVID-19. I think that the school district has done a tremendous job throughout the school year with layered approaches of multiple precautions that each work together to reduce the risk of transmission within the school district. So, overwhelming medical evidence, recommendations from the CDC, state epidemiologist, American Academy of Pediatrics for mask use in schools. That evidence of effectiveness of masks continues to build. Appreciate students, parents, staff working together to make that happen in our district. Vaccines are not 100% effective. We continue to learn what they are, how they last, when we need a little bit more, and we've had the opportunity to also provide for both students and community to be vaccinated through school facilities in cooperation with McGregor Ambulance and the Stratford County Public Health Network. So thank you to those organizations and to Catherine and everybody who was involved in making those multiple events happen over the last year. The goal has been to keep students in school. And that continues to be the goal. And we hear the lengths that the staff are going through to make that happen. We appreciate the communication from parents and staff. That open communication between home and school is absolutely essential to keeping that working. And while I was one of the ones that contributed some groggy middle schoolers on that first day back after Christmas, I appreciate that they were able to go back to school that day. And when we know that there are other parts of the country that are going remote, in the situation that we're in right now. So thank you, keep up the good work, and we'll keep on keeping on. District reports? Suzanne or Catherine?
Good evening. So the FDA has approved the boosters for 12 through 15 years old. The CDC and the state of New Hampshire, though, have not signed off, so we're waiting for New Hampshire to sign off. We are talking to McGregor currently about a booster clinic that could be offered similar to the booster clinic that we had for the 15-year and older students. So more information will come about that, and we will send information home about that as soon as we have the sign-off from New Hampshire. The sabbatical deadline, I just want to remind any faculty watching that we have our sabbatical deadline is January 15th. I sent a last reminder to faculty about that, and I look forward to reading the different proposals with the committee. The YRBS, or the Youth Risk Behavior Survey, was administered to students prior to vacation. This is a national survey that is given to our students, and it really helps us for programming. It gives us health-related data around behaviors, student behaviors, and it has informed programming in the past, and so we look forward to receiving that information. And once we have that also, it takes some time to get that information back. We probably won't see it until the summertime, but when we do get that back, we will share it with you. And winter star assessments are also happening right now for the kids in the elementary, middle, and high school. And that information I will share with you as well. We're very excited about our 2 community events that are going to be happening. One will be on January 13th, and that is Building Bridges. And it's a small group dialogue, almost like a living room conversation around building bridges and differences in our community. And so we really hope that people sign up and register. Information we will send, I sent information out over vacation, but I will send some more information tomorrow about it. And then the second event is January 26th. and that is about perspectives, and that's a panel dialogue. So that's going to be, the format of that will be a little bit different. But the event that's happening first on January 13th is going to be small group discussions, and that we look forward to having, that's going to be a virtual. Both of them are going to be virtual. So when you register for the event, you will receive a confirmation, and then you will receive the link for the registration. There will also be a few questions that will be asked, and that event is from 6 to 7:30 in the evening on the 13th, and that's a virtual event. That's our first event. And then the second event is January 26th, and that is from 6 to 7:30 also, and that is a different type of event, though. That will be more of a panel discussion, where the first event is more of small group discussion, dialogue, and when in talking about it, we want it to feel a little more organic and in smaller groups. So we're very excited about both of those. Does anyone have any questions about those? And we'll send some more information out tomorrow. I'll send some more
So
information.
I do think it's important, Suzanne, that the community that's listening, that people need to know they need to sign up for this event because it is a remote event because of COVID, and we're trying to make sure that we can carry on the intimate conversations that we promised the community we would have. So as this mailing gets out to you tomorrow, it's gone out a couple times at this point, we'll send it out a couple times more. Please take the time to sign up, because it could get to the point where it reaches capacity, and if it does, then we'll just have to create another event at another time, but so that we can be inclusive. But at the same time, there's going to be a limit. We're not exactly sure. I mean, I would tell you it's someplace in the 100, 130 range, and we can push it, but if it gets much more than that, then we'll probably have to add a similar event later in the schedule. So if you don't get in because of interest, we'll make sure we find a way to replicate the event. Thank you, Suzanne.
Thank you, Suzanne.
So before I kind of talk a little bit about, obviously, the metrics and the bad news, I want to circle back for a minute to the 16, 17, 18-year-old clinic we did hold at the high school. Because Suzanne would not give herself credit for it, I want to make sure she gets some kudos tonight. It was a very quick turnaround to get that clinic planned. We worked with Chris Lemelin, who he and his team have been amazing, but it required Suzanne and Josh to really work quickly on getting the electronic consents in, and there were well over 200 consents that needed to be printed. We had to alphabetize them, check all of them to make sure everything was accurate in there. We actually, throughout the day, had some issues with some of the forms, so all day long, Suzanne was troubleshooting that, and so it takes a lot to do this stuff. It is additional responsibility, but our goal is what Michael said, to keep kids in school and to keep school rolling, so this is why we're so committed to it, and so we'll be doing the same thing for the next clinic. We'll be looking at electronic signatures and consent so that we can do the same kind of offering once the New Hampshire gives the orders. But Suzanne did a ton of work behind that, and so she would not tell you that, but she did. So Dr. Morse is going to talk a little bit in a few minutes about our report with Dr. Megan Harvey and some recommendations, as well as where our schools are at in terms of numbers and testing. But as you see in the metrics, things are obviously, like Michael said, at the worst possible place. We are in substantial transmission, new cases per 100,000 are at 855.8, and again, for community watching, anything above 100 is substantial. Percent positive is 16.4%, anything above 10% is substantial. Transmission rate is always a little bit funky. When you look at the data, it's 1.08, 1.2 is substantial. So we're in the moderate zone for that. ICU capacity is officially 100%. As we know, hospitals are working over capacity and canceling routine procedures and not essential surgeries and things like that. However, there are many people waiting what I would call essential surgeries as a human, but there's nobody to do these. Staffing capacity is insufficient at all buildings. You heard the principals talk a little bit about this today. They really are working hard at keeping school open, and it is a huge domino effect when one person is out. And then local contact tracing, we are doing it. It's been a really difficult few days because of the amount of people who came back with positive COVID tests. So we needed to contact trace those and figure out how many students were in our buildings that we needed to then put on quarantine. So that took a couple days to work through all those. What I would say is a majority of families have been really supportive, but we are starting to run against some really negative interactions with how folks are treating our school nurses. And we are working on other avenues to try and stop this behavior because it really is interrupting their job and being able to manage their health office and work with the students who are in front of them during the day. We are looking at making adjustments to how we are testing and how we're supporting our school nurses, and that will be changing in the next few days to week on how we give them some more support. Their testing capacity is big right now. But again, they all believe in keeping staff and kids in school as quickly as possible. Our testing centers are resulting 5+ days out. So if we can get a kid back in 24 hours, we'd rather do that. And the nurses believe in that, so that's why they're really working hard to get the testing done. So I think that's really kind of the where we're at right now. Jim's gonna share some more in a couple minutes.
So stay there in case
Yeah.
you want to add. So first of all, I just want to piggyback the comment that Catherine shared about our nurses. So to give you a sense of what's going on across the district, this is strictly COVID numbers, not related to other illnesses and absenteeism that we're seeing in the district. So on Monday, we tested 38 students for COVID. On Tuesday, we tested 38 students for COVID. And today, we tested 43. So it seems like, well, how does that compare? Is that a big number? Is that a little number? That's a huge number of people who are being tested at school. I also will tell you that the nurses they have my permission and Catherine and Suzanne's permission. If a student comes to school with demonstrated indicators for COVID, we do not test them. We send them back home. I want to make that really clear tonight. We are not a testing service. We are a school system. And our nurses are working their tails off to keep kids in school. If you send your child to school sick, they will be sent home sick. If you're screaming at our nurses, the nurses have the permission to say, this conversation is over, come and pick up your child. I want to put it in context, however, that the vast majority of our parents are reading the memos and following the directions, but we're not in a situation where we can deal with people having temper tantrums because the rules have been put in front of them. They've had them to read. In fact, they had them to read the morning they came back on Monday because I made sure a memo went out, and the nurses were still dealing with people sending sick children to school. Sick children will be sent home, period. So how did all of these students get tested? They called the nurse. They had attempted to get into testing. The nurse arranged a time in the day so that child could be tested. If you need your child tested because you cannot get them tested, we can be there for you. We cannot be there for you if you're rude and disruptive and you are not following very clear guidelines. Those children will be sent home. Thank you, as Michael said, to all of the parents who have been working cooperatively with us. But we are getting to the point where people are making assumptions that need to stop making. We are not the hospital. We are trying to help you. We are not your enemy. We are your friend. Follow the rules and we can work with you. Do not follow the rules and we cannot work with you. That's the message I want to make sure everybody hears tonight. I'm not usually this blunt, but our nurses have taken tremendous abuse in these last 3 days, and I want to make sure that people understand that has to stop. So COVID-specific numbers, I gave you the testing for the 3 days, and David and Misty and Jay for Rebecca kind of gave you the global numbers, which were big. But when you get just to COVID, at Massway as an example, we had 5 staff positive, we had 11 students positive, we had 5 staff quarantined, and we had 25 students quarantined. So that's just Massway. Massway on a percentage term actually was the most impacted school when we opened on Monday. It also was the most impacted school when we closed just before Christmas. You might recall we came super close to having to shut down Massway because of staffing. Moheramet, David alluded to a little bit better. We had 3 staff positive, 4 students positive, 3 students in quarantine, and 9 students in quarantine, 3 staff in quarantine and 9 students. The middle school we had was actually proportionally in a good place. We had 3 staff who had COVID. We had 18 students who were positive. We had 4 staff quarantined and 39 students quarantined. The high school has been 4 positive staff, 31 positive students, 4 quarantined students, and 39 quarantined students. So predictably, the 2 largest schools have the biggest numbers, and so that makes it really hard because we don't necessarily have our staffing proportion to the size of the schools. And at some point in the near future, I want to revisit that with the board.
Can I ask a question about the numbers?
Please.
So you had sent us absenteeism, I can't find the paper right in front of me right now, for Monday, and there was like 100 and something students absent on Monday from the high school, but actually it sounds like most of those were not, in fact, COVID related.
That's right. I wanted to give you the screened out COVID numbers. The high school was impacted by extended vacations and other illnesses like, flus and colds and so forth. So that on Monday looked like, all COVID, and I wanted to clarify that that was multiple issues.
Okay.
In the high school, we tend to have people who take extended vacations when vacations happen, so that was a piece of that as well. So going back to Dr. Harvey, as a school system, we are not physicians, we're not experts in any of this, and so who do we rely on? And, as we've said in the past, we rely on Dr. Harvey. She's an expert in this area, and the feedback that she's getting from the hospitals. And tonight, I just want to take the time to talk about her letter, because when Catherine takes all of this and translates it into data, I think sometimes we miss the global piece when we're looking at the data. So I just want to pick out some pieces of Dr. Harvey tonight. So I'm going to start in the middle. No matter what metric you use to look at our healthcare system, we are overwhelmed, we are understaffed, we are stretched too thin, and in dangerous risk of a situation becoming far worse and needing to start to move towards rationing of care. That's the situation the hospitals are facing. That is what Catherine alluded to when we talk about, you may have what you would perceive as elective surgery that's important to you, but not important in the context of how the hospitals are operating right now and trying to deal with crowded ICUs. So initially, she uses a phrase in her memo that when COVID first started, we were trying to flatten the curve. We're not trying to flatten the curve anymore. We're trying to flatten the surge. The surge is overwhelming our healthcare industry, which is why our nurses at the schools are dealing with a lot more than normal, because they're getting the frustration of parents who can't get get their child tested as fast as they would like to, and therefore their child is, quarantined from school, and that level of frustration is real, and we feel it as a school system. We're trying to be supportive, but you can't use our nurses as punching bags verbally because of the frustration you're experiencing. That really gets us to the issue of the CDC and how irritating it is to have the CDC make an announcement during Christmas break that they're going to make a recommendation that they cut down on quarantine time in half, go from 10 days to 5 days. And then when they're pushed for the science behind it, it wasn't about science, it was about the economy. And so now, who do we follow? The CDC, or do we follow DHHS? This school year, we've been religious about following DHHS. We are waiting for DHHS to take the next step. For whatever reason, CDC decided to do something in the middle of Christmas that really caused a lot of frustration across the country, and it's unfortunate, and it happened. But our governing agency is the DHHS. We've been directed that they're going to come out with guidance. As soon as they come out with their guidance, we'll attack our plan and come back to you with recommendations. We don't make our decisions in isolation. We can't. We're just a school system. We make our decisions following the guidance of the state. Our state hasn't followed through yet on giving us guidance. They're processing that information. I expect that they will probably, most likely, follow the CDC advice, but we're waiting for the state. And when that happens, then we'll follow suit, and we'll bring that recommendation to you. There are other issues that Catherine and Suzanne and I are considering in terms of how we might modify the plan as well. Maybe those will come in concert, maybe they'll come over a couple of different board meetings, but I want the board to know we're not sitting back doing nothing. We're watching, we're reading, we're listening, we're analyzing, and we come back to you. So nothing would happen from my office until I presented it here to this body, to give you a chance to react to, ask questions of, and make sure you're comfortable. So that work is ongoing. And just for, parents who are listening, she added this piece on the Omicron variant. We already know it's far more contagious than the Delta variant. It's actually, I think, 94.5% across the country. Catherine, 93 or 4?
Yeah, it's nearly 100 locally.
Yeah. And Stratford County, actually, thank you, Catherine, is in worse shape than the rest of New Hampshire. This is the area that is most impacted in terms of our hospitals. We also know that our vaccines are less effective, going back to what Michael was talking about earlier, against infection with Omicron than against the Delta variant. A booster dose provides a significant amount of additional protection against infection. So if parents are thinking about it and they haven't done it, they should get their boosters. If they haven't got their vaccination, they certainly should get that. And at this point, we have supported McGregor and Stratford Public Health to the tune of about 4,200 people running through our school system. And parents have been so incredibly appreciative of that. And I want to emphasize that the number of people who have been supportive of our efforts in the school system has been very high. And I think that is an indication of our commitment this year. So, proactively, she says, what do we need to do to flatten the surge? Because this is really where we're at. Wear a well-fitting N95, KN95, a KF94 mask. That's what Catherine's wearing tonight. It's what I'm wearing tonight. But they're saying that the cloth variant masks now are not nearly as effective as these types of masks. Cotton masks and surgical masks do not provide enough protection. So again, that's N95, KN95, KF95 masks. And understand that the data being reported is almost certainly an underestimate. So what we're seeing is conservative. And in that light, I want to share something that I found truly shocking. So we have been told that no children have died from COVID in New Hampshire. Again, over vacation, information was released from DHHS that when we opened school this year, 3 months ago, a child had died from COVID, and they never reported it. So it is a misnomer that, yes, children are not as impacted as people my age by far, It is a misnomer to think that children cannot be impacted and cannot seriously be hospitalized or, in this case, die from COVID. Now, I know that there'll be people out there saying I'm sensationalizing it. I'm merely saying this is a fact. A child at the beginning of the school year did die from COVID. We've had about 800 school-aged children who have gotten sick from COVID. Compared to my generation, thousands of people have died. So statistically, of course it's rare. Would we want to be the school system that didn't do all of these mitigation efforts and be saying goodbye to a child? I don't want to be that superintendent. Which brings me back to the place where we started. Why do we do this work? Michael alluded to keeping school open. Of course. Why do we really do this work? We're trying to keep everyone's children as safe as possible. We will never be perfect, but we are trying to do it because we care about everyone's children with our hearts, not just our minds. And we want to know that Olivia is in a good place. We want to know our kindergartens are in a good place. We want to know our faculty and staff are in as good a place as possible. We've committed to that. I couldn't be more proud of the school board and the school system and our employees in terms of the efforts we've gone through to try to make a multi-layered mitigation system work. And I think we've done a really good job. I'm really thankful that Michael made that statement at the beginning, that he felt we've been doing a really good job. I don't know what more we could do as a school system to try to keep our children and staff safe, but we continue to look at the plan, we continue to revise the plan, we continue to update the plan when we have appropriate guidance. And that's my message for tonight related to COVID, Michael. Any questions?
Thank you, Dr. Morse. Brian?
Just a quick one, Catherine. So if I understand this correctly, if a child doesn't come to school this past Monday because they were positive over the holidays, we don't have to contact trace those because they didn't expose themselves to anybody at school.
Well, there's not a have to, but we do. So if we know there was a gathering and that student, you know, when our school nurse reaches out and, you know, confirms this and says, yep, they hung out with A, B, and C, and it was an overnight, we do make sure those families know. 9 times out of 10, they have informed their friends' families that, you know, they're COVID positive. But we also, then there's a conversation of vaccination status. You know, are obviously still in New Hampshire guidelines if you are vaccinated at this time. It doesn't include boosted, but it's going to be including boosted, that you are eligible to still come to school until you develop symptoms. So we have that education conversation, and we send out that self-observation checklist from DHHS, which is really an important tool. So parents know every day, what are the things I need to keep in mind for my child to make sure that they're not coming up positive if they've been contact traced.
So if they were positive and they stayed home Monday, but they had no interaction with anybody in the district however many days before that, then that's where it ends, pretty much.
Pardon?
That's pretty much where it ends, if they had no contact with
Right.
anybody,
Yeah.
where they get in there after the conversation,
Right.
obviously. All right.
Yeah. Yeah.
All right. And I did want to add that I think the nurses obviously deserve to be treated like human beings. There's no reason they should be treated the way they do. And I do find it unacceptable that parents think they have, or even adults in general, have the right to speak to other people like that, just because they don't get what they want or get what they need. So I think we all need to, everybody out there, I think, needs to understand they need to take this with a grain of salt and put it through a filter and just say, the person on the other end of the line is just trying to do their job. And just because you don't like the job they're doing or the answer they're giving you, doesn't give you the right to treat them with no level of respect. So I just wanted to say I agree with Jim, and please pass that along to the nurses, that they'll have,
Yeah, they'll appreciate
at least
it.
they'll have my support. I'm sure the support of the board as well, if action is taken. So
They are critical to keeping our schools going. This week, as soon as we came back, we recognized some small adjustments we need to make in terms of how we're like having meetings and things. So they were very much in touch with me right away, and so I sent an email to administration to start carefully considering how we're meeting and things that we're doing, and so adjustments have been made based on the school nurses' concerns as a group. And so they are really thinking ahead of, this is where we're at, how can we make sure this doesn't get worse for us? And so they're constantly thinking about, this matters because the goal is keeping school going and not impacting school in a more difficult way. Now, we obviously are concerned about the CDC's updates and how we're going to adjust with those, and we know that'll be a change for us. Once DHHS confirms which way they're headed, they did shed some light today, so we know something's coming. The critical part of that is that within their recommendations coming, Dr. Chan was clear that there's a certain amount of layers of mitigation that should be in place if New Hampshire goes from 10 to 5. We have all those other layers in place. We have masking, we have physical distancing, we have the hand hygiene, we have all those layers already in place here. So making some of these adjustments for us will be a little bit easier because of everything we've had in place from the start.
And also the treatment of the staff, that's not unique to this district. It's happening probably nationwide.
Yes. Oh, yeah.
But still doesn't make it right because other people are doing it. A lot of people think because they see it elsewhere that it's okay here, and it's not.
Yeah,
So
we got to be role models for our children, for each other, and how we behave and treat each other. That goes a long way in how we manage conflicts and work together. It's great when students get to see healthy behavior and how we're navigating and working together to do the best. When they see the unhealthy behavior, believe me, we also see that in kids. So it definitely has an impact on our kids.
In terms of quarantining, like, one of the criticisms, my understanding of the CDC was a lot of people thought it should be if it's going to 5 days, it should be a negative test at the end of the 5 days. Do you anticipate there's going to be, like, if it goes shorter from 10 to 5, that there'll be some requirement for a test, which of course raises a question of where we're going to get the test. So I don't know if you have a crystal ball, but I mean, will testing be a part of the shortening of quarantine?
So the CDC just added that component, but the CDC has given two messages: PCR, rapid.
Yeah.
Rapid is not appropriate to test out of a quarantine, so unless you have symptoms, of course. So I don't think New Hampshire will put a test option in because of the testing capacity. That's my crystal ball. When I think about how difficult it is to get tests, the other piece of it is I'm grateful for our collaboration with UNH and the SAS program. The UNH lab and I talk almost every day. They are amazing and incredible and so responsive. They are overwhelmed as well. So to add all of a sudden all this additional testing will kill our system. It really will make it so that we truly can't be focusing on who's sick and get them out right away. If we start doing more semi-surveillance testing, they won't be able to manage it. And labs across New Hampshire are having difficulty. We have this great lab down the road, and they have been able to give us results in 24 hours. It's taking a little bit longer right now because staffing issues impact everyone everywhere, but we have been so lucky to have the turnaround we have. But we can't overwhelm that system, or we won't take care of the people who are COVID positive day one.
Thanks.
Yeah.
That was my question as well, Tom. Part two is, you mentioned, Jim, that no changes would be made without it coming through the board. If we can...
No, that's not exactly what I said.
Okay.
What I said was I would be making the changes in front of you so you have a chance to react to them, but the way that we've operated this year is the authority to work the plan you've left with me, and I wouldn't implement changes without informing you first.
Thank you for clarifying. I think there are some benefits to the shorter quarantine period, even while transmissibility is still, might still be there. The benefits of reducing the time that students or staff are out of school are also have positives. If the DHHS tomorrow said, made that reduction to 5 days, would we make that change pretty quickly?
I would have to think on that. You see, I'm not used to jumping out in front of the board too far. I would probably consult with Michael and Denise off the regular meeting before I would make a decision like that.
That it wouldn't need to wait till the next board meeting?
Depending on that conversation, I would want to talk to board leadership before I stuck my neck out that far.
There's factors within that 10 to 5 that we have to think about. For example, after day 5, there's still a little over 30, it's either 31 or 34% still contagious. So when we're looking at that, we got to look at that piece and just kind of, talk it through. So it's not an easy, let's just go 10 to 5. It's like, if we go 10 to 5, we just have to talk through and think through what this means, and then obviously how it impacts our schools and our nurses, because they always chime in. When there's a change, they are our school health experts, so they are definitely chiming in to the conversation and giving guidance to us.
And it's my understanding that the 10 to 5 is only for vaccinated people, or is it
It's all
for everyone?
over the
it's for
place.
everyone.
Yeah,
Okay,
it's
so
all
I
over the place.
had in my mind heard, that
It's
that
supposed
applied.
to be, yeah. It's all over the place for vaccinations, but also if you're symptomatic versus asymptomatic, it's different. So that's why we don't know what DHHS is going to give for a final bullet kind of list. So once that comes through, then we'll have more guidance on what, which direction that we need to head.
Because a single 10-day quarantine may not be all that different than a 5-day quarantine, but for the families who, for whatever reason, are choosing not to be vaccinated, as much as I or anyone would want them to, what's happening with some of the kids is that a parent might test positive, so that they're quarantined, and then there's their own, it's the serial quarantines, right, that stack up.
It's the 20-day.
Right, and then they get exposed again and then need to do it again. And so it just adds up to a lot of days away from school.
Well, right, if they have more than one occurrence, for sure. And those are components that we're also looking at. Will there be other guidance within that? Because the CDC has given some guidance. They've also given other recommendations that we've been looking at. But again, we're looking at how much we can manage and handle as a school system, which is managing a healthcare crisis while we're trying to teach kids. So, as soon as those come out, we're not going to go slow. We're going to work as fast as we can, but be diligent and thoughtful like we have been all along. Impulsive decisions just don't work well.
Thank you very much, Catherine.
Thank you, Catherine.
You're welcome.
And then the last thing I would like to talk about, Michael, actually goes back to UC talking about the remote day. Technology is always going to give a certain level of hiccups, and we certainly had that, but it wasn't overwhelming and didn't shut down the system. The remote day was very successful from the reports from the principals. The number of emails that I received, I had one negative email versus, probably a dozen positive ones in terms of how the day went. I think we were really prepared. I want to commend the principals because they had been doing dry runs through the fall, much like we do fire drills, to make sure things would operate. And so by and large, it was successful. And the reason I bring it up is because Friday's coming. And we've been watching the Friday weather since Monday. And, we've seen estimates as high as a foot of snow, and we've seen estimates as low as what we saw today, an icy, rainy kind of day. So Friday is a bit unpredictable. At one point, it looked like a good old northeaster, and other points it looks like just buck. And so we will keep all options on the table. This is really why I wanted to bring it up tonight. We could have had initially on Monday, I was thinking, oh great, the kids will have a wonderful snow day and we'll see them out playing and enjoying themselves like, is traditional in New England. And then as I, go through the week, I say, oh, I guess we're not going to have a snow day. And Olivia's thinking, oh God, it was like, I needed that day to get ready for midterms. But, it could just as easily be a late start. on Friday if it's kind of like today. And it could be a remote day. And what drives that is the memo I sent out to families basically saying if we have a good old-fashioned snowstorm, we'll have a good old-fashioned snow day so that the students can enjoy it. And then if today had happened earlier, it actually worked out almost to prediction. They said that the icy, slippery roads would come in at around 9:30. They showed up at 9:30. They'd be over by 1:30, 2 o'clock. It was over by 1:30. And between 9:30 and 1:30, the roads across the district were a nightmare. And we had many accidents. All of our buses were told to pull over and sit still, and they did. That would be our high school Voc Run buses that would have been out, our PEP buses. We canceled one session of PEP because it was not safe enough to put the buses in motion. And our buses sat until Public Works was able to treat the roads, and we just did business as usual. So there was some disruption today, but it wasn't as dramatic as it could have been. And then a late start would be the same type of day, but starting earlier. So if I had gotten up at 4:30 like I did this morning and that kind of wet drizzle was happening, that could be a late start using the estimate of it being over in 3 or 4 hours. However, if it's an estimate that's going to last longer, then we go to a remote day. So trying to signal out to the families that we now have options. If we know if foul weather day is coming, you can expect, one of those 3 options: late start, remote day, or school being canceled. And it's all defined by the weather event. And I wish I could say it's perfect science, but we all know it's not perfect science. And it's best guess at the time you're making the judgment. So listen for Friday. So we don't know yet what Friday will be. And that's it, Michael.
Thank you, Dr. Morse.
You're welcome.
Would you like to introduce Dr. Smith?
Good. So everyone, Dr. Andrew Smith is the director of the UNH Survey Center. When you see big survey reports from the state of New Hampshire on presidential elections and gubernatorial elections, he's right in the middle of that, hired by whomever to do this work. And he also does small projects for us. And in the scheme of things, this is a relatively small project for his operation, but he's worked with us over the 10 years I've been here, probably 3 or 4 different times. And we always love working with him. He's got a great operation. And what we have tonight to share with you is 2/3 of community survey. The 2/3 that we have ready are the staff and parent components. And we'll get out the broader community survey here shortly. We asked Dr. Smith to come in and give us the results of the first 2/3 of the survey this evening. And so, Andy, the podium is yours.
Thank you very much for having me here tonight. I should say that I am a 22-plus year resident of Durham, and I've had 2 kids go through the school system, so appreciate the work that you all done. And I guess this is now for something completely different. We've had some, at best, moderately depressing news this evening, so I want to give you some good news. And hopefully all of you have seen a draft of the report so far, so if you have questions about that, I'd be happy to answer any questions that you've got. I'd like to just go through some of the highlights that I think are most important from the study that we've done. As Dr. Morse pointed out, one of the things that we try to do when we do any sort of research is to focus on what are the management decisions that you need to make with a survey data, with surveys. Surveys are expensive, time-consuming, and they have a lot of issues with them. But the management decisions that you need to make as an organization are what is critical, and what we try to do is provide you information that help you make those decisions. We can't tell you what the answers are. We can just provide you some information to help you help inform those answers. So, as Dr. Moore said, that this survey project overall that we talked about is really consists of 3 components. One is a survey of parents, which I would argue as a former parent of a student in the school district is probably the most important audience that you need to be able to communicate with, to clearly communicate with. The second is with the staff. And the third is with the community more broadly. I should say that parents and students parents and staff are the two easiest groups to do surveys with. You already have contact information from all of them. Community in general is a much harder thing to deal with. Gets into a whole lot of methodological issues that I think we touched on earlier. But we are planning to do that in the next few weeks, start and get that going with the community. So for the things I want to talk about today, we had the survey that we did was in November, early November. We got responses from 713 parents, so that was about a 52% response rate, which in the survey world is really, really high. My experience is that the people who don't participate in surveys tend to be the people in the middle that say, it's okay, everything's fine, I don't need to worry about it. And what you hear from in surveys are the people at the end who are either very happy or the people who are very angry. And what I would argue that you should focus on in any sort of survey like this is pat yourself on the back to say you're doing a good job, because overall you're really doing a good job of communicating with people. But I live in the world of continuous quality improvement, and try to focus on the people that are having some difficulties and look at the reasons that they have difficulties and aren't as happy, and not treat them as saying, we don't have to worry about them because there aren't so many of them. Say, okay, how can we make them happy as well? So that's one of the overall philosophies I try to bring into any sort of management survey like this. But overall, the response rate from staff was significantly lower. I'm not quite sure to say what all of this was due. Some of it is just frankly a technological thing that you different sorts of surveys see, different sorts of internet technology see surveys that come out as spam. And a lot of, I think faculty might have got it blocked from that. Also, faculty get a lot of surveys all of the time, and they may have ignored them. One of the things that's important, though, that when we looked at this, there are really only minor differences between staff and the parents in how they evaluate the communications between the school district and them. And where you do see differences, they're fairly obvious reasons why there are those differences. For example, the very first slide I'm going to show you is that the staff feel that they get a lot more communications from the school district than parents do, which is pretty obvious because they do get a lot more communications. But overall, communications are really good. And the one thing, if there's an upshot from this, is that they want a centralized calendar system. I speak from step aside from my survey research hat. As a parent and even at UNH, a centralized calendar is a very valuable thing to put in place that has all of the things that are going on in one central place. So I'm going to go through these very quickly, only because limited time and you already have this information. I'm going to leave time for questions. But I want to touch on some of these things. When we ask people about how often they typically receive information, is it about right, too much, or more than once a week, about once a week? You can see that staff receive more information than parents do. Not surprising. They ought to receive more information than parents do because they're working at the place. When we ask how many emails do you feel you typically read, here again there's not much difference. Staff say they read a little bit more emails than parents do, but not too much. And overall, we got a high percentage of people say, yeah, we pay attention to what's going on when we see communication. So that's good. One thing to reach out to people and give them information. It's another thing if they actually pay attention to it, and they are paying attention to it. The third one is, how would you describe the frequency of emails you receive from the following entities? And I just want to focus on the overall block because I think that summarizes it. We think that we get about the right amount of emails from principals, administrators, teachers, less from the school board, but that's because a lot of people say they don't know, because I don't think many people get direct communications from the school board. They're relying on secondary sources for that. something you may want to think about, if there's a way that you want to put that in place, if you feel it's important to have some more direct communications with parents and the staff from the school boards, something to think about. But from the administration itself, the communication seemed to be about right. How would you describe the length of the emails? It's about right again. People are happy with that. They're getting the amount of information that they believe they should get. How clear are the emails that you get? Once again, from the administration, principals, and teachers. Clarity is there from the school board. It's not so much that the clarity isn't there, it's just that a lot of people don't get those. They're not getting any communications from the school board itself. So again, take away from this, as a school board, you might want to think about what you can do as a board independent of the school district itself to communicate with people. Clarity of emails is good. Quality of emails is good. There's very little problem with that. Quality of communications is high from the administration, principals, teachers, school board, again, a little bit lower. How would you rate the quality of information you get from the school, from ORCSD overall? Very high. You're in the 80% range. That's quite commendable. What I would say is that we like to, in quality improvement, 90% is typically where you want to be. You're really close to 90%. You can't ever get everybody to like everything that you're doing, but 90% is a good target. You're almost there, so you might want to think of some of the things that you can do to get to that 90%. What are the biggest weaknesses in communications from the school district? Not enough communication comes out as number one. Secondly, the lack of communication for a certain schooler level, and they want some different methods. So you can see from this chart here, there's nothing that really shows up here as a major problem, and I think that's a good takeaway. When you look at the way people want to get their information, you're doing it right now. For emergency or weather, send me a text. Get that right away. It pops up on my phone. I see it right away. For almost everything else, send me an email. And even in those other sections where they say send me an email, the number two thing is send a text. So sending texts and emails, you're largely going to communicate about all of the topics that people are concerned about in a way that's valuable to them. So good that you're doing that already. Would you like a little, more or less email about these following things? Teacher outreach, board minutes, and so forth. You can see in this one, current level of communications is just about right. Nobody's really complaining that they're getting not enough information. Very few people are complaining that they're getting too much communication. So I think that you're hitting this pretty well. On the following topics, it's pretty good. How often have you accessed the website? A lot of questions about the website that we put in here. How often have you accessed the websites? Well, obviously here, this is another one of those differences between parents and staff that really makes sense. Staff spend a lot more time on the website than parents do. And how would you rate the following aspects of the website? Organization has seemed to be pretty good. Content good, up to date. It's easy to find things. One thing I would say with this, people here are pretty much saying things are good. Not as many people are saying things are great. I wouldn't take this to mean that things need to be overhauled or revamped. But I think what could be done is to focus on the things that people are most concerned about. So and I think that comes into the next things. What have you had difficulty finding over the last few years? And the things that they pointed out they had difficulty finding when they wanted to get information were, first, a calendar. Second, contact information. And third, school board information. Fourth, information about sporting programs. What happened with the hockey game the other night? But the calendar is something that we focused on a little bit more later in the survey. Contact information is a real simple thing. And just to make those things, bring them up to the front page, make them very obvious on the front page that where you can find this. I'll speak from my experience at UNH. I still forget where the directory list is. Usually you could probably look at this thing, it's way down at the bottom of the page. Everybody in the IT department thinks that you should know where these things are. Put it up at the top in the front where the knuckleheads like me who can't find things can see it. Some just basic things like that might be more helpful. How would you rate the quality of information on the website? Again, overall, it's very high. There's really not so much of an issue here. What would you like to see improved by the website? More up-to-date information, classic problem with any website. Anytime you have a website, it's only valuable if things change, data change, and you've got the most up-to-date information, which requires people on that. And it also requires to have more new content. Sometimes that new content's not there, but up-to-date information. Some concern about better organization, a little bit concerns about easier to navigate. The staff, for some reason, don't like the visuals. Maybe they want to see their own pictures on there, but I don't know if that's a terrible concern. What would you like to see included in the website that's not currently there? Sports information actually comes up. Again, people love to see what's happening with their kids, what's happening with their teams. General information about clubs or after-school programs, etc. So there's nothing here that really jumps out, but there's some things that are somewhat obvious that could be done. Sports is the reason that you see college sports is such a visible thing, in part is because it's an important part, but it's also something that ties people to the organization. It ties parents with their kids involved with sports. It ties the community to the school district if there are sports. The same thing happens at the college level as well. So that's I'm stepping outside of my official role here as a researcher, but as a parent, that's something that I would look for as well. It's just a nice thing that ties the community together. That's one of the reasons that we have sports in schools, one of the reasons we have sports in universities as well. A calendar. Now, so this is something that we asked some specific questions about. How helpful would it be to have a calendar that had all of the things that were going on at the school district in one place? Overall, 59% say that would be very helpful, 30% say this would be somewhat helpful. So this is something that if you're going to focus on, is where I would focus my efforts on in IT about that. The next, sorry about this slide, the way it works here. The next slide is asking about engagement. So we move from calendar to engagement. How much do you say you engage in the school district? There's about 2/3 of the people say they, or 3/4 of folks here say that, of parents say they engage quite a bit, but you still have about 25% who don't engage that much with the school district. And how easy is it to engage? Here's something that it's okay, but you still have about 30% here who say it's somewhat difficult to engage with the school district. Now, I know that there's outreach aspects to do this, but maybe that's something to look into a little bit more about what is it that people want to do, how can they engage, how do you pull people out of their kind of busy lives shell to engage with school districts. It's a difficult thing because, you know, you've got realize that not everybody wants to engage, so the next chart says how likely would you like to engage more with the school district? Well, 43% say yes, 22% say no, I don't want to engage more, and another 34% say I don't know. So one of the things I think would be careful about this with this area is the presumption that everybody wants to engage in the school district. No, not everybody does. I speak too much. Happy when my kids go off to school in the morning, they come back at night, and I don't have to hear about anything in the middle of it. I'm good. We asked some questions about community forums. How often have you watched the school board meetings? Sorry to say for the folks here, they're not watching as much as you might want them to, or maybe they are watching as much as you might want them to. Staff tend to watch more than the parents do. When we say, have you had any difficulty, have you been unable to watch the school board meetings in the last year? Well, most people say they haven't had difficulty with that, and if they have, the reasons they say is they've had other things to do. I break it to you, but I'm not going to change my Wednesday night schedule. And then finally, how likely would you be to attend community forums if they were held by Oyster River? Again, not that many people are really desperate to do this. There's some people that say it'd be likely to, but I would say that you're reaching people already. You can maybe push some people more, but it's not like you have this big audience out there that's demanding more access to the schools, to the school board, et cetera. We just have to be cautious about respecting people's personal lives and all the other things they have to deal with. So overall, I would say that this is a report that says that the school district is communicating very well with faculty and staff, with faculty and staff and parents in particular. And I would say as a parent, former parent of a child in the district, that's probably the most critical thing. The community communications survey that we're going to be doing next, I think it was going to be very interesting, and that's important because the community is paying the bills for all of this stuff. But for the people who have the kids in school right now, I believe they're getting the information that they need. They know how to get it. A calendar where everything is centralized would be really helpful. The ability to find contact information about who they want to get in touch with, and that's a very easy place. Be very helpful. These are fairly straightforward things which could be done fairly quickly. But overall, I think this is actually a very good finding for how the school district communicates with these two major components. So with that, any questions that you have, I'd be happy to try to answer them. And I'd be happy to come back when we get done with the next component of this study and report that back to you.
Thank you very much, and thank you for bearing with us this evening. Denise?
The only question I have is, will we get a copy of that report? Because that was different than the one that we got that had split out.
This report, basically what we did, the slides, and I will make these all available to you. And in fact, I have some more that I didn't report here tonight just for being more brief. I can give these all to you. And Dr. Morrison knows that we are pulling these slides apart to be able to present these to you to separate parents and staff to make it easier for you to see things. I think the takeaway from that is there's really not much difference between how parents and staff believe things to be.
One of the things in the longer report that was the backup that we saw was differentiation, not necessarily between schools, but between different respondents who had children at different levels. Could you speak to, I guess, how the survey was designed, what it can and cannot answer, and any findings at the sort of building level?
Well, at the building level, I think what you're seeing there is the concern that parents have with their children as they're younger. You have a much greater concern about letting them away. What are they going to do? How are they going to be able to interact? Once they get to junior high or high school, you have less concern about what's going on. Your kids are becoming adults, not as big of an issue. This, I think, are natural sorts of things. How we designed this is that we tried to get as much information, demographic information from parents as possible so we could break these things out. And yes, there are some differences in there about how people want that communication, but I think they're kind of the natural life cycle desires that people have. But one thing I would want to point out is if you look at the report from this, it's fairly long. A lot of it are open-ended comments. Typically, open-ended comments are overlooked. I would encourage you to read those because for you to understand more richly how people believe things are working or aren't working, you can see what people say in their own words about those things. And if you're trying to make some changes, you might get some really useful ideas from some of the specific things that people write down in there rather than from the overall percentages.
Yeah, that was one of the things I wanted to call out, or in the comments. I think it was really rich. But just at the building level, to be clear to people who are watching, there wasn't a question like, how is middle school principal communication? It was, how is district, how is communication? And then, oh, by the way, you happen to have a child in the middle school and at the elementary school and at the high school. So we can't get down in really detailed granularity but we have a way sort of to get to the communication at each building level.
You're right. One of the problems that we had when we designed the study was that we know that we have parents, we have families that have kids in multiple levels. And we don't, it's a balance between how many questions do we ask each person about each one of those levels for each student versus a more general thing. What we were able to do, though, is be able to say, you have a student, we know you have a student in this grade level, how did you respond? So it's not quite as precise as the way that you want to get at it, but we're hopefully highlighting some of the differences that might be there. But my takeaway again from it is that the sort of differences that we're seeing are kind of the natural differences that you would expect to see, given the different ages of the child as they're going through school.
It was interesting because a lot of the folks wanted more high school teacher communication. So sort of flipped. Another thing that stuck out to me in the comments was just the big question of, are my kids on track and what are they learning? And a big part of that is Schoology. And so, and the report cards that come through Schoology and the report card process to get teachers' comments and what sorts of things they're writing in their comments. Was that a part of the
No, that was not something that we really focused on here specifically. This was more general communications, what you would think of public relations, but the overall communications between the school district and the parents and staff generally. But again, to your point about information that you get about your children, do you ever get enough? Is there ever enough information that you know that your child is really on track? You always want more, I think, as a parent. So maybe that's something to think about, is that we should presume that parents want more. And if they don't choose to pay attention to it or read it, that's fine, we'll at least provide it for them.
Tom?
Well, these findings, I'm very encouraged by it, and it's consistent with what I see in terms of reading the newsletters that the parents, that the principals send out. And I think particularly, Dr. Morse, your, I think, real writing skill in terms of communicating, because I think you set, in some ways, I think you set the model for administrators to write, and I think it's been very, very effective going through very difficult times. And I think the consistency and the clarity of your letters to the community, I think that's part of why these numbers are where they are. That's what I'm thinking.
And Professor Newkirk, I really would like to emphasize that as well. This is not a survey that was taken in normal times.
Yeah.
This was a survey that was taken in times which of much greater concern, much more heightened concern for parents and for staff as well. And that the communications that came out in this difficult time when people are paying more attention to communications, I think illustrates your point that this is done quite well.
Are you wanting to open a discussion about where?
I can't hear you. Can you?
Are you looking to open a discussion on where we go from here, or simply questions about the findings?
Well, I think where we go from here is, well, one of the questions is what do we think the timing is going to be on the community survey, and do we, the plan was to reconvene some subset of the communications committee that we had last spring to kind of chew through the feedback that we've gotten here. And the question in my mind is, do we do that twice, once with this, and then once again when we get the community feedback, or do we wait until we get the community feedback to do that? So I don't know if you have an opinion about that, Dr. Morse.
Personally, I think what we just did with Andy is very effective, because, it's a lot of data to absorb, and there's only going to be more when we get the community piece. So if we could pull the communications committee back again just to absorb this piece, and then Andy be working on the second part of it, then I think we would get more specific feedback from the committee. Now, just remember that committee wants to pass the baton. They're very clear that, they put a lot of time and effort into getting us to the place where we were ready to do a survey, but they don't want to become the perpetual communication surveys. But on the other hand, I believe they have a lot to offer in terms of the transition. So they were very curious about this survey because they knew it was coming. I sent it out to them, and I'd love to be able to bring them back together and ask some critical questions related to what they perceived the survey was telling them, and then we can use that as a springboard to create the next iteration of the communications committee. They got quite exhausted last year. I mean, they really did a lot of hard work, and they stuck with it, and I really appreciate everything that they offered. It was much different than I expected. It was much different than Michael expected, but it was rich, and it was a dynamic conversation, and I think that now that we have this piece, Andy's pointed out two very obvious pieces that we could work toward very clearly, and it would be interesting to see what else the committee sees when they have a chance to look at it. So that would be what I would like to do, Musi, is reactivate them as one-offs to create transition to the next iteration of the communications committee. Because I think that's what they want. They want to be able to hand it off, but they also want to be part of the transition. At least that's the communication I felt they were giving us. Michael, do you agree?
Right, yeah, I think that's right.
There were a couple things that jumped out, and I know that one place we're trying to get is to know what our priorities are and how to resource those, whether they can be done internally, whether we need to look externally. If we look externally, what type of person or people would we bring in? And in reading the comments as well as in some of the higher level results that Andy shared, the four categories, like what are parents especially are wanting to know, what are the immediate opportunities and to-dos? How do I find this person? What form do I have to sign? They want to have a sense of the big decision or strategy of the district, and maybe as a board we should think more about how we communicate those along with you. The celebration and engagement, but this question of how are my kids on track and what are they learning? Yes, we always want to learn more. I think it's notable that this survey was done before the report cards came out, and the question of how Schoology is working to give parents updates on their kids from that first term would be important here. Some of the things that popped out just as low-hanging fruit, though, or as really obvious next steps would be the attachments in the emails, right? So to not have to click on a link, but to have the content there. On the website, to have past updates from building or from the district administration, to update it, to maybe have the Teams links and other contact information on the site, and have this better organization or easier to navigate. How far do we want to go with that? Is it a small tweak or is it a big one? The centralized calendar. So questions I would have is that something Josh can lead, or do we need to bring in folks from the outside for that? And then there were some pieces around actual content. So, more desire from counseling about the college admissions process, or, about sports, or from the school board. And additionally, just protocol. So including staff on the communications that go out to parents, or changing the subject lines. So I hope that we're able to, in reconvening the committee, to actually to start putting some of these things in buckets and assigning them, so that we have the right resources to move some of these things forward, not sort of have a committee part 2 where we're looking for additional information past this.
To both your points, I think that breaking this into different audiences at the very beginning is a good thing to do, because the different audiences want different information and need different information, and how you design the best strategies to communicate with those people, I think, needs to be separated into those different audiences. You've got a segmented audience here. Starting with these two audiences that we just talked about tonight, I would argue are the most important, who want information the most frequently and most critically for their day-to-day lives. is something that should be acted on first. The general community, I would not wait to get those numbers back to see how the community more broadly wants to get information, but I'd focus on these two populations first.
Yeah, thank you. I think that there's a lot of insight here, and like I said, there's 44 pages of comments that there's probably a way that we can kind of parse those out and share them with the stakeholder groups that they apply to in some cases as well. The only other couple things that I saw in them, that kind of themes that to add to what's already been said, we need to be thinking mobile first in both website and email or other communications. There's the vast majority of folks are going to look at that communication on their mobile device and maybe never again on anywhere else. The word Schoology shows up more than 30 times in the comments, and then the word consistency I think is a theme there. And while overall especially classroom communication seemed strong, I think that's where maybe the consistency factor is a piece where there are maybe not best practices or opportunity to kind of share what share what's working well in some cases. So, yeah. Other questions or comments?
Well, I just want to say thank you to Andy. I was, looking at the global results, I was really quite shocked at how good they were. Not to take away from the specifics that Yusi and Michael just articulated, but I was really surprised, quite honestly. Communication surveys are notoriously, excuse my expression, bad, because they usually tell you you're doing a pretty bad job of communicating. Public schools have a heavy load because of staffing and because of some of the issues we've talked about tonight in terms of consistency. I have to say that when I looked at this initially, I was like so pleased that we, were in the 80th percentile so often across so many different areas, and that parents overall felt like they were getting information clearly and succinctly and as frequently as they wanted or needed. And so, yeah, I really appreciate the percentage of parents who participated. That's extraordinary. And the overall impression for me is, yes, these specific things need to be addressed, but they're doable. And when we were starting this process, quite honestly, I felt overwhelmed by, this whole issue of communication. Quite honestly, I have my entire career as a superintendent. It's really difficult to hit all of these audiences in a consistent way. And so thank you for taking the time to do this for us, Andy. And as Michael said, there's a lot here that we can work with, and I think Yusi's pointed out many of those things as well. And I feel better about our starting place than I did a year ago, because I feel like we have more concrete information. Everything a year ago was I feel. Now it's parents feel, staff feel. It's not our feelings. It's what we're seeing from them, and that adds a power to the conversation we didn't have a year ago.
Well, I think also you were in a position of hearing from the people that are most unhappy. You tend not to hear from people that are pretty happy with what things are going on. And I think that's just a general takeaway from a lot of the things we do. Public life is that most people generally are pretty happy. You just hear from the people who aren't, and those are the people who are calling you.
And the fact that the survey was done during the pandemic, actually, I thought it would, again, be a negative, and it turned out that people were paying attention, and we didn't know that a year ago, so we now know they are paying attention, and they are appreciative. So, globally, I just really feel good about this work, Andy, and thank you so much for doing it.
Thank you for having me. I'd be happy to come back again, present the results from the community survey when we get that finished.
Yeah.
Thanks, Andy.
Appreciate that, yeah. All right, that brings us to the business administrator. Nothing tonight. And then the student representative, Olivia.
All right, hi. There's just a few things I wanted to talk about tonight, not too much because there hasn't been too much of anything since we last met. But I wanted to say thank you to everybody who put in the work to get the booster clinic before break. That was really amazing. I know me and my peers who wanted to get the booster were very happy to have that opportunity. So in my opinion, it went well for me personally, and I think a lot of my peers would agree with that. That week, our Winterfest got postponed due to having the remote day, and like the middle school principal had said, it's moved to February 18th, so like the last day before February break. So it kind of will have that same still like effect that it was supposed to have, I guess, because it's right before break still, and it's still winter, so it's good. And then
It may end up being a spring fest.
yes.
Summerfest.
Maybe. And then the remote day overall went fine. It did stir up a lot of old memories, but it overall went well. Yeah. And then the return back to school from break, I think went decently well, besides like having to wake up early again. That was a little unfortunate, but other than that, it wasn't too bad. The roads today were pretty bad, so there was no junior and senior privilege. And so we had to eat lunch like in the school, which was first time for me this year doing that, which was kind of interesting. But it overall, I think, was handled well, and I'm happy that nobody was on the roads because it was pretty bad. And then upcoming midterms, and I don't know if I'll see you guys before midterms again, but that's definitely going to be an interesting thing since half the building has never taken a midterm before, and the other two grades, my grade and the juniors, have only done 1 or 2 midterms. So that's definitely going to be an adjustment. I know that I have to like relearn how to take midterms and all that stuff, even since it's been so long. But so we're all preparing for that, and that's everything. Any questions?
Thank you very much.
Awesome. Thank you.
There's no Finance Committee report tonight.
Nope.
There is no unanimous consent agenda. So that brings us to the discussion and action items. So the first one there is the 2022-23 school calendar. And Dr. Morse, you want to introduce what's in the packet?
So I tried to be very definitive for the board this evening. We know that we're in the face of a mini controversy related to next year's calendar, in particular February vacation, and our alignment to the CTE centers in Dover, Somersworth, and Rochester. So the 3 centers have chosen to take a non-traditional February break outside of the state recommendation, and that has caused a flurry of feedback to the board, our board, related to aligning our calendar with the state as opposed to aligning our calendar with the CTE centers. I did give you the conflicts. If we align with the CTE centers, in particular Dover, Somersworth and Rochester have fewer students. Dover has the vast majority. We would be out of alignment with them 6 days. If we choose the state recommended week, we will be out of alignment with them 11 days. Michael asked me to follow up with the superintendents with conversation perhaps about whether they would be willing to provide supplemental work during this time period, and Dover would be interested in pursuing it but couldn't guarantee it, and Rochester's teacher's contract wouldn't allow them to even pursue it. So I think that, when we're looking at this, we have to look at this as a hard conflict as opposed to a soft conflict, meaning that if we choose to go the traditional New Hampshire week, those 11 days are real. The only thing that we can offer that we control is busing for our CTE students who would wish to go to school on those days, and we certainly would do that. We do not have an indication of how many students would participate at this early stage, but we certainly would commit to that. We may get students who are committed to their CTE program enough that they would go, and then we would probably get a good body of kids who would want to be in the same cycle as their high school peers. So I think, if you just look at it from a teenager's perspective, that would be probably the social part of it would outwin the academic part, but we have had a couple of emails where parents of CTE Center students want us to offer the bus. We would do that, guaranteed, but we just can't guarantee how many kids would choose that option. So that's where we're at, Michael, and the calendar issue at this point is in the board's hands.
Brian?
If we went with the conflicting week, when the kids are off here at Oyster River, would that be marked against them for not coming to class, CTE class?
It'd be marked against them at the CTE Center, but it wouldn't be here because we're not in school.
Right, but so it would be...
It would be an absent for them there.
Okay.
Have we polled CTE families?
No.
Denise?
So I've been giving this a lot of thought, and you know, one of the things that we are obviously concerned about is the mental health of our students, and I think the stress that it would put, and it's true, we haven't done a survey, but just thinking about it in terms of students that might be stressing about missing their classes, but also tempted to be with their peers, and I just think, I understand that from families' point of view, it is definitely not ideal to take the February 20th through the 24th. But I think for this 1 year, I think it's the right decision, particularly in light of, you know, discussion we've had about students having to miss because of quarantine, because of COVID. You know, this would be additional days. So, you know, with everything as much as COVID is, I mean, maybe families aren't planning to travel as much, I'm not sure, but I just think we should go ahead and stick with this calendar the way it is for this year. And if this becomes more of a long-term issue, which my understanding is it probably isn't, but if it were, then I think we would have to revisit it. But I think for this year, we should stick to being on the same cycle as Dover and the other schools.
I understand everything. I understood everything you said, Denise, but even the three CTE centers are not absolutely aligned because everybody has different calendars, so they'll have 1 or 2 days different from each other.
Right, I meant in terms of February vacation. I should have clarified that. Absolutely, I understand there's some other days in there, but specific to February vacation, I think we should be on the same week as Dover and the other two.
Tom?
I would agree with Denise. I think we should go with the calendars presented with the earlier week. It seems to me there's a real educational reason for doing that. And I think that we should give greater weight to the educational reason. And I know that it's inconvenient. I know that costs of travel might be higher given this kind of, if people want to travel given this week, but I think that that's the week it should be. It should be the week as presented, the earlier week. So that would be my position.
UC.
Absolutely, the educational priorities of the students take priority. However, we are presuming, unless we talk with them, with these families, that is their desire. We've heard from one CTE parent so far at the podium who said that family vacation to him trumped the days that would be missed. And in speaking with other families whose, you know, who, like one person is a teacher in another district, they're not able to travel as a family either. And so it's not that we would be making a decision based on the, you know, the rest of the families that want the cheaper vacations. I still think we should ask the CTE families for their desire before we make the decision, presuming we know what their priority will be.
So, and in doing that, we would only be able to poll the families who would be in CT next year. So it's about 26 children impacted.
Or, you know, or poll all of them as representative.
But all of them wouldn't be representative, only half of them are. Because half of them wouldn't be returning.
I mean, as an example of
I see.
The current year families are experiencing this year. so they certainly understand the situation.
Gotcha.
What it would mean to miss 5 classes
Got it.
or not to.
Olivia?
Kind of going off what UC said, I think it would be more helpful to reach out to families who have students who would actually be in the situation before, like, coming to a decision, like, in what we think that they would want to do, kind of. Like, I feel like it would be very beneficial to actually, like, reach out to those families to see what their thoughts are.
Because Denise, your point about mental health and the strain of this year, absolutely, like, and I can also imagine the strain of a family being pulled in different directions and not being able to take this, precious time before a student leaves high school. That's what we heard from John. So I can see it going both ways.
Having worked previously in Split, like I was working in a district that had a different vacation week than my son, I mean, lots of parents don't even get that whole week. So, I mean, you kind of deal with those realities. I'm thinking, I'm just thinking more from the student's perspective, but I mean, I'm not opposed to trying to do a survey. I do agree, however, that even though the seniors would not be impacted next year, that as a sample, so that we can have a larger sample, that, we should still survey those students. I would say if we are going to do a survey, let's survey all CTE students currently this year and say, if this happened, how would you feel? What would be your preference?
Survey to the students or to the parents.
It doesn't even have to be a survey. It could just be letting the families and the students know that this is a board decision that's underway, and if they have an opinion, they should write in.
If we're really concerned about minimizing the number of days that are not overlapping between Oyster River and Dover, Rochester, Somersworth, we should take a look at the other days as well. We should take a look at moving the October 7th day to December 9th, and we should take a look at moving the Oyster River January 23rd day to March 17th. That's 4 of the days that you have identified on the...
Say those again, Michael.
Well, it's the...
January.
So Oyster River takes October 7th, which is the Friday before Indigenous Peoples Weekend. Dover takes December 9th, which Oyster River doesn't take. I don't know why they take that day, but we could take that day and then they would align. Same thing, we take the January 23rd, which I think is the end of the semester typically, although sometimes with snow days it's not exactly the end of the semester. And Dover takes March 17th, which Irish holiday in Dover? I don't know. I'm sure there's some other reason beyond that. So we could look at those two if we really.
We can minimize it even further,
yeah.
you're saying.
And I think we need to recognize too that Dover, Rochester, and Somersworth are the districts that are not going with what the state recommendation for the calendar is. And I think that needs to weigh in there as well. Aside from the winter break, I think it's important to point out that this calendar does not start school until after Labor Day, and that pushes the end of school out till at least June 17th, and potentially, with 5 snow days, June 24th, which seems like way too late to end the school year to me. In the past, when we get to that, to days like that, we end up saying, we don't care about making up those snow days anymore, let's just skip them. But that is very far into June. Even the 17th would, the earliest we would end school is pretty far out there. And at minimum, I would like to see us bring that back to, not have the last day of school be a Monday.
To start school before Labor Day, as we traditionally have.
That would be my preference. Yeah.
All right.
So I guess the question here is, do we want to, I think what I'm hearing is we're not ready to take action yet, that there's enough variables here that we want to wait one more meeting to do that. Is that right? Or does somebody want to move action on the calendar?
Not essentially, we do it tonight.
Yeah, I can get this survey done for the next meeting, or the questionnaire, whatever we're going to call it, and we'll look at these adjustments as well, Michael, and come up with another variation of the truth.
Did you have something else to say, Brian?
I was going to move forward, but it doesn't sound like it's going to.
Can't hear you.
I was going to move it forward, doesn't sound like it's going to get any traction, so.
It just feels if we're going to make a decision that's going to be unpopular with a lot of people, we should be confident that the people that we're trying to help believe that it's a help.
It's so much easier because this is like the first calendar that I'm not going to be part of. Done.
So you're ready to make the motion.
You won't get all the letters next year.
No, and again, it won't impact me because I have a senior, so it's like, it seems so much easier to make a
I
decision.
hope, with this information, I hope the board is in a better position to make a decision because parents do start making their plans for the spring. So we'll get this information to you and another variation or two in front of you and see if we can get it done in the next meeting.
All right. Thank you. The next item is the 2022 warrant articles. So you've got item 5 in the packet is the draft warrant, and we're looking for a motion to approve the warrant articles. Brian?
Do we have to do these individually, though, right?
Do we?
I believe, don't we go through each article and say
Could do it
we
as a
support or not? Because, well, if you're going to say this, if you're going to say that the board supports this article, you actually have to vote on that article.
But you really shouldn't be doing that until after the public hearing.
We have public hearing next week.
I just noticed that. What you really need to do is figure out who's going to present.
So we should not be approving the warrant tonight?
You should really wait until, you can approve it for public hearing, but you have to have your public hearing before you can really finally approve.
Well, and the public hearing is only about Article, the budget, right?
Right, but it gives you some input on what you're presenting, and that impacts your warrant.
Right.
Because your budget's on your warrant.
And you can always revote later.
Right, you can.
You can revote after the public hearing.
Well, we have to, right? We have to
Yeah, you have to.
action the budget after the public hearing.
That way, at least maybe you're showing the people that the board does support.
Right. Okay, so let's hold off on that until after the public hearing, until the next meeting then. The next item is assigning presentation of warrant articles. So here's what I would like to recommend to the board. Al? I was going to give you a pass.
I assumed I'm doing Article 3, right?
No, I was going to give you a pass. I'd like to ask Tom to do the Distinguished Service Award. Article 3, which is the budget. Brian? I think that it makes sense to keep the two negotiated agreements, Articles 4 and 5, together. And as a member of the negotiations committee, Dan, I'd ask you to do that one. And then I did the solar warrant related to putting the money into the facilities trust fund last year, and I would be glad to do that one again. So it would be Tom for Distinguished Service Award, Brian for the budget, Dan for the negotiated agreements, and myself for Article 6. So I will move that as a recommendation to the board. Denise?
I will second that.
Any discussion? All those in favor? 7 in favor and the student rep in favor. All right. Jim, the public hearing discussion?
Just to remind everyone that the public hearing is next week, and it's, as you just heard, a non-binding presentation. It's to inform the community where we are in the budget process, what the warrants look like, and then to get feedback, and then the board will come together at their next meeting and finalize their decisions around the warrant. So it's next week, it's the 11th, it's 7 o'clock.
And that's a Tuesday, not a Wednesday.
That's a Tuesday.
And it's in the auditorium, not here in the library.
It is in the auditorium, it will be socially distanced, it will be masked, and usually it's a comprehensive A to Z by me, answer any questions the community has, and then it switches after that meeting to you guys.
Sounds like we may need an email reminder.
Yeah, well,
of what it is,
I'll put out
where it is,
multiple
because somebody will
reminders.
end up here on Wednesday, I'm sure.
There will be nothing here on Wednesday in the library next week. All right. Jim, did you want to talk about the superintendent self-evaluation here?
Sure, I'm okay with doing it here. Just in terms of efficiency, we normally don't, but there's nothing in my self-evaluation that I'm not willing to share in the public. I think we've had an extraordinary year. If you look at the self-evaluation I wrote, and I'm more than willing to put that in the public record after tonight, we accomplished a lot in the face of one of the most massive obstacles that school systems have faced across the country in COVID. And I do want to start out by saying that the operative word is we, even though it's my evaluation or my self-evaluation or my self-reflection. Nothing we've accomplished as a school system has been the job of one person. And it really starts with the school board. And the thing that really, and I'll use kind of language you used when I was writing it to you, I was very familiar, I was less formal. What saved our bacon as a school system is having an adopted strategic plan. Knowing where we wanted to be as a school system and what was important to us prior to COVID made all the difference in the world in our successes in this last school year. We struggled mightily, just as all other school systems did when COVID first started, and we struggled with how does this fit into a school environment and how do we organize this work around all the other priorities we had as a district. And initially we let it kind of roll over us. You know, it was just so monumental and so unique and so needy for time and energy that our academic mission and our other priorities really took, I wouldn't even say a backseat. They were no longer in the car as we were trying to figure out how to deal with COVID. That summer, the administrative team met, so I'm switching from you guys to the administrative team, and we said, look, this is not going to operate. This is not the way we want our school system to be run. We need to shake COVID and put it in its right place. We couldn't ignore it, but at the same time, we can't ignore our other priorities, and this is where the strategic plan came in. And so we sat down that summer and really talked about how do we, focus in on the other needs that our students have and the other needs our school system has. And so, one of the things that I was most proud of in the fall was when Suzanne presented the academic scores for our school system, and they were as high as they've ever been. And I put that credit to our administrative team and our teachers over the course of that summer, laying out the foundation of what is important for us to not ignore in the face of COVID. And collectively, we did really good work. And again, as we do that, we have to remember that we did have to make decisions that were tough. We couldn't be the same school system facing COVID that we were prior to COVID, meaning that we had to compromise. And, I remember David and Misty talking about the fundamentals of our primary program, because remember, our primary program feeds everything. And so we really needed to figure out what was important to get done academically, and we focused there first. And we built a structure for that second year of COVID that was highly effective in the face of doing something we had never done before, which was essentially going totally remote from the middle school to high school for 3/4 of the school year. That laid the foundation for the results that you all saw this fall. And then the second major piece, and I remember when Tom and I were very early on in this, and the idea of social emotional learning came up. And I have to be honest, at that point in time, I knew little to nothing about SEL. And, I listened very, very carefully to Heather McAnuff at the time, and trying to make sure that I understood what this piece was that all of a sudden was going to sit side by side with math, reading, and literature, and get a sense of why this was so important. And I'm so glad I listened at that point in time, because it too was an important foundation for the work that we have been doing in the midst of this pandemic. Had we not done SEL, we would have been missing a huge piece of service to our students. And so that was incredible. Throughout the pandemic, we never lost a step on DEIJ work. That was amazing. And committed community members who came in by the dozens to help us continue that work during the pandemic. Again, not the work of Jim Morse, the work of a community who said this was super important to all of us. And, you know, as you read my self-evaluation, you know, I give credit to so many people. We have had a tough year. Our nurses, as we talked about earlier, central to our health initiative for our kids this year, stepped up, have been working their tails off, harder than they ever expected. School nurses never expected to be in the middle of providing background service to a pandemic. And of course, the administrative team, and I say in my report, you know, our bench is not deep. Dan loves it when I talk sports analogies. Our bench is not deep, but we have a heck of a bench. And people have stepped up when they struggled. You know, I've sat down, we've talked through it, they've stepped up to the challenge. It has been, and quite frankly, one of the most challenging and most rewarding years of my career, seeing how our staff and faculty, administrators, our parents, our community have stepped up, and the successes we're experiencing as a school system really start here. And I really give a lot of credit to a lot of people that we're in such a good place as a school system in the middle of an extraordinary time, unprecedented time. And I don't see the end in sight, quite honestly, which I was trying so desperately to hope I would see at the beginning of the school year. But I think Omicron has showed us that this thing is very aggressive and very active, and we'll see various variations, no question, in the upcoming months. But we have a strategic plan, and that is all you guys. We worked it, you adopted it, it gave us a place to hang our coat that was all about students, and that really has been the reason we've been as successful as we have in this school year. Not saying everybody wants to send me kumbayas and group hugs. What I'm saying is we've done really great work in the face of challenges that no one would have expected at any point in their career. So that's my report, Michael.
All right, thanks. Let me just kind of telegraph the rest of the meeting tonight because it gets a little bit complicated here. First of all, I apologize, there is a missing item that's very important. We've got the ORPAS agreement. You have a copy of that in your blue folder, and it was on our agenda previously, but ORPAS had not yet ratified it. So they did that right before
They have now, yeah.
right before the December holiday, and so that's now before us to approve as well. So what I'd like to do is take up the ORPAS agreement, then have a hopefully brief non-public session related to the SAU administrator contracts, come back into public session to move on that. If there are any other committee updates or public comments, we'll deal with those at that point in time, and then a second non-public related to our process for the superintendent's evaluation.
If there's no controversy or discussion about those contracts, could we just not vote on those? Would we have to go into non-public? Or do you think?
I guess I think it's something that has been controversial before and therefore merits a non-public session. I'm sorry. We can vote against a non-public session when we get to that point if we so choose. Yeah. So if that's okay with everybody, then the first thing would be the approval of the ORPAS agreement as presented, which we had the framework for that before, we just couldn't vote on it because the union hadn't ratified it yet. Brian.
A motion to approve the ORPAS agreement.
Brian moves to approve the ORPAS agreement. We have a second from Tom.
Second.
Is there any discussion? All those in favor? 7 in favor, the student rep in favor. The ORPAS agreement is approved. All right, now I'll move that we go into non-public session under New Hampshire RSA Chapter 91A, Section 3, Paragraph 2, Subparagraph A, the dismissal, promotion, or compensation of a public employee, and so on and so forth. Is there a second?
I will second
I
that.
have a second from Denise. This requires a roll call vote, so we'll go around the table.
UC Terrell, yes.
Dan Klein, yes.
Tom Newkirk, yes.
Denise Day, yes.
Michael Williams, yes.
Al Holland, yes.
Brian Cisneros, yes.
All right. And so we'll go around the corner for non-public, and we'll be back in a few minutes. So.
Sorry, one thing before you go.
All right, it's 9:25 and I declare us back in public session. And I would invite a motion to approve the 2022-23 SAU administrator contracts for assistant superintendent and business administrator as presented by the superintendent. Brian?
So moved.
Excellent.
Second?
All right, we have a motion from Brian and a second from Tom. Discussion? All those in favor? 7 in favor. The contracts are approved.
Thank you very much.
Are there any committee updates? Not a lot of committees.
Just a reminder, I forgot the date already. The date of the next, the what?
21st.
21st at 3 o'clock is our final tour of the middle school building. So it'll probably be a big one. So I don't know if people will be there. As I get closer, we'll see if we have some wiggle room for more people. But I think you're the only one I haven't heard from, Dan. Are you in?
Yeah, I don't know if I'm free yet.
Okay, and you're going to be a little late, right?
I'll be there, but I'll be a little bit late. Yep. Thank you for
Don't get
organizing
lost in the building trying to find us. But it's you. I'll tell you, even if you were there 3 or 4 weeks ago, it is
Transformed.
exponentially different. It's going to look ready to be used as soon as you walk in there.
Fantastic.
And it's going to blow your mind.
Yeah, so count me in. I was 3 weeks ago, so you've convinced
All right,
me. Okay.
all right.
Okay.
I'll save you a hard hat.
All right.
Yeah.
Yes, thank you for organizing that. Yeah.
No problem.
Other committee updates?
I just want to add on top of Brian's that we're beginning the conversation on unexpended balances related to the middle school and how we would expend them. We've had a number of items that we've delayed because we were unsure whether we would have the funding. We'll be revisiting that conversation Friday and again next Tuesday.
That was, sorry, question. So is that something that would just be decided at the committee level, or would that be brought to the board?
Generally, everything's been decided at the committee level, but if the board, I certainly will bring the list to the board and explain what decisions.
I'll be at that meeting too, as the board rep. So.
And there's a lot of work still to do in terms of demolition and
Exactly.
fields.
Yeah,
So
and
not like-
that's still a big mystery.
We're
It's
not
the X
talking
factor.
about $3 million left at the end of the project.
No.
No, definitely not.
Other committee updates? Public comment? All right, so closing actions, you see the future meeting dates there. Jim is presenting at the Durham, Madbury, and Lee Council and Select Board meetings over the next several weeks. Public hearing on Tuesday, as we discussed. Our next regular meeting is January 19th. All right. Was there a comment there, Jim?
I think, Dan, that the meeting at Madbury is in the morning, not in.
Oh, I was gonna
not
ask
in
about that.
the
They usually
evening.
meet in
So
the
I'll correct that in
Okay.
the minutes. I just looked down and saw PM, and I know that's wrong.
That is, I believe you're right. Their meetings on Fridays are typically at 8:30 in the morning.
Yeah.
So I know you like to be there, so I'll get you that in the morning, and I'll repost it. If it's published inappropriately here, I'll get it reposted.
All right. So then I'm going to move that we enter non-public session, and then we will, after that, we will just be adjourning. There'll be no other action after that. So I will move that we enter non-public session under New Hampshire RSA, Chapter 91A, Section 3, Paragraph 2, Subparagraph C, which is matters which, if discussed in public, would likely adversely affect the reputation of any person other than the member of the public body itself, unless such person requests an open meeting.
So Michael, that's the or pass contract, right?
No, this will be us discussing your evaluation.
Oh, it's me, so I can leave.
You can leave.
Yeah, we already did
Well,
all
in that
that.
case,
wait till we fully.
Unless such person requests an open meeting. But yes,
There's no non-meeting then, right?
that will be a non-public session.
There's no non-meeting then, right?
There is no non-meeting, right?
Okay, yeah.
Right. That would have been for the OR pass if
Yeah.
we had done that, yeah.
Anyway, I will second the
Okay.
motion to enter into
So
non-public.
motion from me, second from Denise. This requires a roll call. Can we go around the table?
UC Terrell, yes.
Dan Klein, yes.
Tom Newkirk, yes.
Denise Day, yes.
Michael Williams, yes.
Al Holland, yes.
Brian Cisneros, yes.
All right, so we are back in non-public session.